Are you an ophthalmologist wanting to move to the UK? Or do you want to pursue a career in ophthalmology in the UK? Then this video is for you. Hi, I'm Dhanashree and welcome back to my YouTube channel. Today we're in conversation with Miss Priyadarshini Suresh. She is an ST3 in ophthalmology at Wessex Deanery, UK. She did her MBBS from KEM Hospital, Mumbai, and MS in ophthalmology at Maulana Azad Medical College, Delhi, after which she moved to the UK in 2020 as a medical retina fellow at Ipswich General Hospital. Then she got into Southampton University Hospital as a Caesar fellow. After a few months, she applied for ophthalmology training in the UK and currently an ST3 in ophthalmology at Wessex Deanery. So, Priya, I know her since a long time now. We know each other since MBBS. We were even roommates for a brief period. She is one of the most sincere and hardworking people that I've met. Not only has she agreed to do this with us today, but she's also kindly prepared a presentation so that it's easier for the viewers to understand. So thank you so much, Priya, for doing this, and I'm sure this is going to help the viewers immensely. Over to you,
Hi,
Priya.
Dhanashree. Yes, thank you so much. Thanks for the very kind words and lovely introduction. And I think you're doing a great job by helping so many people across the world trying to move and get their dreams into motion. So as Dhanashree said, I've just prepared a quick presentation. So basically, my talk is about how do you become a consultant ophthalmologist in the UK. Now, you can obviously become an ophthalmologist in the sense you can become an eye doctor, but a consultant ophthalmologist is the path which is the path for career progression to become a consultant or an independent practicing ophthalmologist. So, just to give a brief introduction, there are two paths to becoming a consultant. So, one is your CCT path, or also known as a Certificate of Completed Training. CCT is basically awarded to all those people who have completed post graduation in ophthalmology in the UK. So that's the standard route which people take who have obviously who are locals in the country and who have done their medicine and foundation years. They enter into the CCT pathway. The other pathway is known as the portfolio pathway, also previously known as a Caesar pathway, which basically stands for Certificate of Eligibility into the Specialist Register. That's mainly a pathway for people who cannot enter into the post graduation, but who still want to become a consultant. All right. So let's just look at these two more in depth. But before that, we need to know how post graduation in ophthalmology basically works. So ophthalmology post graduation in the UK is called OST, or Ophthalmic Specialist Training. It's equivalent to your MS or MD in ophthalmology in countries like India. So I did my MS, so that was my postgraduate qualification. In the UK, it's called OST. Now, this is 7 years. It's called ST1 to ST7, so Specialty Training Level 1 to Level 7. It's a run through program. So that means once you enter into ST1, you automatically get promoted to ST237. That's how you climb the ladder. Once you finish ST7, and if all your competencies are up to mark, you will then be awarded the CCT. During this period as well, in this 7 years, you need to finish off your FRC off the exams. So just like at the end of MS 3 years, we write the MS exam, which gives us the MS degree. The recognized postgraduate qualification is called the FRC OFT, and which has 4 parts. I don't need to go through it in depth, but you need to finish all those 4 parts before completing your ST7. And along with that, you get awarded the CCT. So basically, I'm concentrating on this part. Specialty training is 7 years in the UK, and it's ST1 to ST7. After entering before entering ST3, you need to have finished the first part. Then after ST3, the refraction certificate. And then before ST7, you need to have finished the part 2 exam. And of course, you need to go through all the 7 years of training. Then you will be awarded CCT, and then you can become a UK consultant. So that's how it basically works. Now, if you're an IMG and you're looking to enter into post graduation or entering into OST, It's a picture which is now a bit into a confusion because it's changed now. The curriculum has changed. I got into training at ST3 level. So in this picture, you can see that the entry point into OST was at 2 levels up to last year. So you could enter at ST1 or you could enter at ST3. I applied for ST3 entry, and there was no cap on the number of years of experience. So I had done MS in India, and I had worked in the UK for 2 years. So I had 5 years of experience before entering into OST, and that allowed me to enter at ST3 level. But that no longer exists, and that's been stopped now because the curriculum has changed from 2024. So now you can only enter at ST1. Now there are various criteria for entering into ST1, but just before that, if you need to enter into ST1 after MBBS, so you suppose you haven't done MS or DOMS and you want to look at post graduation directly after MBBS in the UK, the first step is you need to hold a full GMC registration. So I think Dhanashree has probably covered that in her other videos about how to register with GMC. After that, you need to have evidence of foundation training competencies. So, internship in India is called obviously internship. It's a 12-month rotation in various subspecialties. In the UK, it's called foundation training. So, you need to have evidence of completed foundation training program. So, you need to have completed all those competencies, either from a UK approved foundation training program, or you could have completed 12 months medical experience after a full GMC registration. The details of this are obviously there on the website, NHS England website. I'll be sharing the links. It gives you more detail about what does this 12 months medical experience basically entail and what all does it need to cover. Obviously, the other criteria is you need to be eligible to work in the UK. So you need to have a work visa, work permit, and all that, which you will get after your GMC registration. The other catch is you must not have more than 30 months of experience in ophthalmology. So this is a change. Last year it was 18 months. So those who had more than 1.5 years of experience could not apply for ST1. Now they have changed it to 2.5 years, so 30 months. So typically, if you've done MS in India, you would have done 3 years. That makes you ineligible to apply even to OST because now entry is only at ST1. However, if you've done DOMS, which is diploma, that's only 2 years, so that's less than 30 months. So you would be eligible. But this does not include your foundation training. So this is excluding foundation program. 30 months is the cap. So this is the NHS England website for one of the links is this. This is the Ophthalmology ST1. It's a very, very important document. It says person specification and entry criteria for Ophthalmology ST1 2024. Now, this is really important because it's different from last year. 2023 entry was different, and this is a new updated page. So this gives you everything. So it's a very huge, exhaustive document. I have just listed the very essential things which are important to know prior to application. Very essential criteria like your MBBS and all of that is eligibility criteria. Everything is there in this. So I really highly recommend you go through this page. I've mentioned it in the link. The other page, which is really important, is this page, which is basically the evidence folder. So the evidence folder is basically whenever you apply to OST or any specialty training in the UK, it's not through an entrance exam. One of the obviously there is a sort of MCQ test or an exam held as well, but your evidence, your application is in the form of an electronic evidence folder, which you need to upload on a particular website called Oriel. And it basically comprises of multiple domains. Now, these are all the domains. It's obviously very, very exhaustive. I've just made a sort of important tips you need to know before you apply and prepare your portfolio. You should always maintain a log of whatever you do. So typically, I did not maintain a log when I was in India. I gathered all my evidence when I worked in UK and made a log of whatever I did. But if you're applying directly into ST1, it's really important you maintain a log. Now, this log is for your clinical work and your surgical and your laser work. So um, so you should always have a discussion with your consultants about what cases you are learning, what cases you are seeing in the clinic. You need to anonymize all patient data. So whenever you're preparing a log, do not include patient's name, date of birth, hospital number. Any identifying patient data should all be erased before you prepare your log. That's really important. The other thing is the GMC needs a syllabus of your training. So if you're doing your basic training, or if you're having any experience less than 30 months from another country, you need to have a syllabus. So in the UK, there is a particular curriculum which is available on the Royal College website. Similarly, you need to have a curriculum from where you are being trained. So that is really handy. It needs to be signed off by consultants. You need to have a certificate to say that you have been trained in all of these specialities or subspecialties. Now, many people ask me, is MRCS useful?
Before
Now,
you move to that, Priya, can I just ask you the log that you're talking about? Where did
yeah.
you log your cases? Was it e-logbook? Because we use that.
Yeah. So if you have access to an e-logbook, it's available on the college portfolio. If not, there is a substitute for that. There's an Excel There's an Excel spreadsheet which the Royal College has given as a guide. So I can share that link as well. So that's an excellent sample spreadsheet of what all you need. So that's really important. So right from day one, whatever cases you see, whatever surgery you do, you assist or you do under supervision, you should log it, and obviously anonymize all of it. Everything is there in that Excel worksheet. So that's really useful.
And does that need to be signed and stamped by a
It
consultant?
needs to be signed and stamped. It needs to be signed and stamped, ideally by whoever has supervised you.
Okay.
So if you have a clinical lead or an HOD, they are the ultimate authority. I had done it from my HOD. I had provided a summary of my logbook. But if you can do an individual, like if somebody trains you and if you can get somebody to immediately sign and stamp it there, nothing like it. That's like very authentic evidence. So that cannot be questioned. All right. The other thing is MRCS useful? Now, many people ask me, should I do MRCS, FRCS before coming to UK? Now, you need to understand that firstly, MRCS is not scored. If you are MBBS is the eligible criteria. If you look at desirable criteria for qualifications, it's mainly like BSc or MSc. MRCS is not scored. It's not even useful for a GMC registration point of view. You need it for ophthalmology, you need FRCS. For that, you need to have passed the OSCE. So you need FRCS, and that's only for GMC registration. If you want to get into the career path, you need FRC Opht. So this is just my point of view that MRCS firstly is not scored, and therefore it's not very useful in preparing your portfolio. All right. Now, there are many things we miss out when we prepare our portfolio. So, obviously, when we are in India, we always think about, or another country, our priority is clinical and surgical work or laser work. But we miss out on a lot of important other domains which are equally important. And in fact, they carry the same weightage as your clinical and surgical experience. So, what you need to do is, firstly, it takes a few years to prepare your portfolio. It took me almost 2 years, full 2 years to prepare my portfolio before I submitted for ST3 entry. And you need to look at the evidence folder. That's the link which I'm going to share. The evidence folder very, very clearly outlines what you get marked on and what you do not get marked on. So if you prepare your evidence folder right from the outset, like a few years before your application, that really, really helps. So you can get everything organized into your domains, and it very clearly mentions how many points are essential for what domain. So just a few tips is that we generally tend to neglect certain things, and that's why I'm stressing on these. One is prizes and awards. So if you stood first in your final MBBS exam, that counts. So that's really important. So prizes and awards is really good. If you've got the best poster or best presentation in an international or national level conference, they really count. So try to get as many prizes and awards. Then the exam point of view, I would stress, if you're doing any FR exams, the fellowship of the Royal College, you really do the FRC of the exam, because that's the one which is counted towards your career, and that's the one which also gives you GMC registration. The thing is, if you're going to apply for ST1 entry, it's important to do the part 1 and the refraction certificate. The part 1 and refraction certificate give you points. They're not essential. It was essential for ST3 entry, but for ST1 entry, if you have the part 1 exam or the refraction exam already done, you get a lot of extra points. So that really helps towards building your portfolio. There's something called MSF, which is it's something which you will learn once you come to the UK. It's called multi-source feedback or 360-degree feedback. It's an important and integral part of your ST1 application. Basically, it means that you collect feedback from 360 degrees of your workplace. So from your colleagues, junior colleagues, consultant colleagues. In UK, we work with receptionists, secretaries, nurses, sisters, healthcare assistants. These are all really important to just judge what kind of a candidate you really are. So an MSF is really important. We do the MSF on the college portfolio, which we get after becoming a member. But if you're in India or if you're another IMG, then you get a sample MSF, which is available on the GMC website. So you can just download that. It's basically Word documents, which you need to give to your colleagues. And a supervisor has to collect that information for you and prepare a report. You cannot see the report of other people, but your supervisor will collect it and formulate a report and give it back to you. And that report is very important for your ST1 entry as well. Obviously, it goes without saying, publications are very important. If you are a first author, that's the best. But you get scored only up to first 4 authors. Anything after the 4th author, you do not get any points. So if you're 5th or 6th author, it does not get counted in the publications domain. So make sure if you're doing publications, you're in the first 4 authors.
And does it have to be PubMed indexed?
So peer-reviewed index journals are obviously better. But having said that, even if you submit a non-peer-reviewed article, it gets counted as interest towards ophthalmology. So you may not get scored in that domain, but there's a separate domain which shows that you are dedicated towards the subject, and you get probably half points there, but you do not get full marks in the publication domain. Obviously, needless to say that original articles are scored higher than case reports. Case reports do not have that many marks. So if you're trying to get publications, try to get original articles published. Then there's something called an audit. Audits are very, very, again, in the UK as residents and even as specialty doctors, we are mandated to undertake an audit every year. So audits basically help in service improvement, quality improvement. And it's quite easy to do an audit once you know what the audit cycle is. That's a talk for a separate day. But you need to know what an audit is and what is the audit loop. If you can identify a problem and audit it, basically you collect data, analyze it, formulate reports, and then give suggestions for improvement. And completing the audit loop by doing a re-audit, this gives you full marks, especially in that domain. And you should ideally be an audit lead. If you participate in an audit but not the audit lead, you get less marks. So try to propose an audit locally wherever you're working, and try to be an audit lead. You cannot do it on your own unless it's a very small audit. You need participants. So try to be an audit lead as much as possible. Then obviously, needless to say, posters, presentations, they carry a lot of marks. Oral presentations carry more marks than posters. And oral presentations in international meetings carry more marks than national meetings or local meetings. So try to go higher and higher in the way you present and where you present. The other thing is education and training. So UK really stresses and emphasizes on further education and training, so they like people who are involved in training juniors. So make sure you regularly undertake teaching for, let's say, medical students or interns. Get certified that you have undertaken education and training. So get certified from a consultant that you have probably undertaken teaching sessions, or you've conducted some exams. These are really important, and try to attend some training and education courses. They also give a lot of marks if you've done a degree or a diploma in medical education. So I know that's a bit far fetched, but I'm just telling you what are the domains which they really prioritize. Okay,
Also,
so
I'd like to add that when you're talking about education and teaching your juniors, it should ideally be a structured program, not just a one-off session.
yeah, exactly. So try to get into a regular structured teaching program, and it should be certified. So you need, for everything you collect and submit, it has to be certified. So that goes out saying, everything has to be signed and stamped by a consultant. And try to present all your evidence in a very systematic and organized way. The way you present your evidence is also marked. So you get 3 marks for beautiful and neat, organized layout of your evidence folder. So that's really important.
And this is all
Um,
online, correct? The evidence folder.
Everything is online. Everything is online. There's no physical application. The applications are through Oriel, which is a website meant for all specialty training posts. I mean, that's as far as I'm aware. I'm not sure if it was the same for you,
Yeah, it was the
Dhanashree.
same for me as well. Yeah. Or
Yeah, so it's Oriel is the website basically where we electronically submit all our evidence. So I had a lot of paper evidence, so I had to scan them all up and condense them into PDFs. So the sooner you start looking at what the requirements are, the earlier you can start preparing, ideally before MBBS, because you have a gap of 30 months. So you can't really prepare in the last minute, because so many of these things require time, especially if you're looking at audits and MSF. They take minimum 6 to 7 months, so if you're looking at really seriously looking at OST at level 1 entry, then you really need to start preparing a few years in advance. So yeah, I think the take home message is, getting into OST is now only at OST 1 level. There's no ST3 entry, and you have to have less than 2.5 years experience. And if at all you're having any experience, it has to be documented and systematically organized, and you must look at the evidence folder which is there on the link I will be sharing.